Umakyat sa 1,054,900.
The U.S. is once again tackling an alarming surge.
CDC now says Omicron.
The country logs the lowest
cases
daily
in
New
almost 2
Omicron
months.
strain is already
travel in and around COVID-19.
The numbers are skyrocketing.
269,436,597 cases are recorded.
COVID cases up until December 11 this year around the globe.
The question is, why is that?
Well, the main question is not how many are infected, but that how potent it had been. WHO recognized statistics suggest there are only 1.97% fatality up until this week. That is equivalent to 5,317,559 deaths. This then should imply an awakening in the real numbers that made COVID a monster. The key word is COVID risk factors. That is the root of how economically, socially, and medically devastating this pandemic is. Yes, never before have we been this industrialized, scientific, and this technologically advanced as a society made it to the 21st century. But never before have we been this obese, this diabetic. Never before have we had these numbers of 10,980,000 annual heart disease deaths, 10 million cancer deaths. Clearly, these epidemics of diabetes and immunocompromised people are the main fatal COVID risk factors we have that empowers the villainy of COVID-19. If our highly at-risk population of sick and elderly people would not have been infested with preventable epidemic diseases, it would not have been this fatal. We seem to be masters of panic treatments versus the wisdom of preparedness.
But look at the epidemic statistics that we don't care about despite its higher implication in pandemic fatality. If pulmonary diseases, if air pollution with 7 million deaths annually, which is also pulmonary, if climate change, stroke, tobacco, cancer, and heart diseases each outnumbered COVID-19 deaths annually, then they, being the risk factors that makes the severity and deaths caused by this pandemic, then we should first deal with them. But why are they of less alarm an epidemic statistic, technological, and political global community? Body fat is one of the best bed of roses for the virus. We've seen US being the most obese country and now remains at the top of COVID-19 death cases. Who cares how our society advertises deadly Coca-Cola and unhealthy food industries? The scientific community believes that 100 times more potent fatal than COVID is coming all the way from factory-farmed animals. Have we really understood zoonosis?
Well, if we are social distancing, the meat industry offers us animals that are so congested, a perfect breeding ground of mutated viruses, making them fatal if transferred to humans. And guess what? Up to 80% of antibiotics are fed to these populations, which in turn bring us deadly mutations. And never before are we near the era of antimicrobial resistance, where pills will become useless as bacteria and viruses become superbugs with a death potency much more than pandemics. Thus, after all, COVID should then be more than just a wake-up call. We no longer need a neutral science. The science that we need should be an outrageous truth that brings green revolution. We need a revolution. If vaccinations had been our last recourse as we are caught unprepared, we are also required to be as globally united, not only in an integrated diplomacy, but in a global radical action. Our science should give birth to not just technological advancements that bring not just carbon neutral, but carbon negative, sustainable, and socially responsible pursuits. Up until now, our scientific community seems to be oblivious of how environmental, of how climate health is so much interlinked with pandemic destructiveness.
If macro ecosystems are becoming extinct 200 species every single day, then pandemic issues aren't just issues of habitat loss, but animal and environmental health due to imbalances of ecosystems through unsustainable industries. If 10,000 years ago, free-living wild animals make up 99% of the biomass and now only 2% were left of them because we have them all exploited in the name of domestic indulgence to meat and animal products. This is not an issue, more of our overpopulation, but that in every human of 7.8 billion population we've been technologized in a toxic way up to 80 billion farmed animals and fishes. Let us not be ignorant as to how big the picture is. Never before we had a human who on average is able to consume 11,000 pieces of microplastics in seafood. And even a small marine life could have thousands of them in their tissues. Then what about the countless toxins, chemicals, and contaminants that may affect in a micro level? Or in macro level, if we had almost lost most of species in the macro level? This pandemic should teach us how destroyed micro ecosystems are.
Never before have most of our soils been so acidic, and our oceans steadily by 2015 acidity, toxic cocktail. Again, COVID-19 should teach us that acidosis, as pro-inflammatory alike in human diseases, beat in human diseases. Most are a state of acidity in a gut microbiome researches. Acidity intoxication kills and annihilates good bacteria population that are supposed to annihilate bad bugs and viruses. There's that ecosystem, the microbiome world, and because we cause mutations and disruptions through our toxic, acidic, and highly chemicalized antibiotic-exhausted world, then we deserve pandemic 100 times deadlier than COVID. All has been said, and the only viable solution is that we should realize that again, we need a good enough revolutionary green one world. Through One Health approach, sustainable development mechanism that will save us from such an existential threat, the end as we know it.
Animal health,
Human health.
And environmental health.
In One Health.
In a one post-COVID new normal world,